Care to chat? Hello and welcome to our podcast from the Northern Ireland Social Care Council. Social care and social work are such enormously important parts of life here. They really came to the fore during the pandemic. And now with the crisis in the health service, they're in the news again. So in these podcasts, we're going to find out about these jobs, about the people who work in them, the routes into social care and social work, how staff can progress and develop their careers, about the reforms taking place, and very importantly, how people in these fields take care of themselves as well as their clients. Round the table with me are Patricia Higgins, CEO of the Social Care Council here, Jennifer Welsh, CEO of the Northern Health and Social Care Trust, Jonathan Patton, who's Chair of the South Eastern Health and Social Care Trust and Vice Chair of NICON, Confederation for Health and Social Care, and joining us online, Michael West, CBE, who's a visiting fellow with the King's Fund. It's great to have you all here, and so glad, Michael, that you've been able to join us as well. It's very much your thing, compassionate leadership, if I could put it like that. Why is it important? And maybe in layman's terms, what actually is it?
Well, it's a pleasure to be with you all, and thank you for inviting me. Compassion is part of who we are as human beings. You know, if somebody falls in the street, you see people immediately rushing to help. And the guru of compassion, Paul Gilbert, defines it as a sensitivity to suffering in self and others with a commitment to prevent or alleviate it. And, you know, that's very much what our health and social care systems are about. And our challenge, I think, as leaders is how we create the conditions where staff will deliver high quality, compassionate care for the people in our communities and where they'll be compassionate towards each other. So that's about creating compassionate cultures. In practice, compassion is about, you know, if somebody's in pain or distress, then to be compassionate, I have to attend, understand, empathize, and help. And attending means being present with them, listening with fascination to what their concerns are, their pain is, their distress is, seeking to understand the causes of their distress through having a dialogue with them, empathizing with them without making it my drama, and then trying to help in some way. And so if we want to create compassionate cultures in health and social care, as I think we absolutely should, then we need leaders to embody compassion in their leadership. And that means leaders embodying those four behaviors in their leadership: being present with those they lead, listening with fascination, having the courage to seek to understand the challenges that those they lead face through having a dialogue with them rather than imposing an understanding from an elevated hierarchical position, empathizing with them, feeling what it's like to be a nurse on your third 13-hour night shift in a row, not having had time to take your rest break, and then helping them. And in the context of leadership, helping means helping those we lead to do their jobs more effectively by helping to remove the obstacles that get in the way of people doing their jobs, and by helping to ensure they've got the resources they need to do their jobs effectively, the right numbers of staff, the right equipment that works, and the right training, for example.
Is there a difficulty in this, in that sometimes acting in those ways, which would seem like exactly the way that we would all like to be and the kind of boss that we would like to have, but that can be seen as being weak, as maybe some people might feel that it would seem like they weren't in charge?
Well, compassion is about courage, you know. I was talking last week to a group who'd just come back from rescuing people from the rubble in the earthquake in Turkey, and they had been tunneling under collapsed buildings with aftershock still going on. And that's what compassion is. It's about having courage. It's not some soft, cushion-scented candles approach to leadership. It's about having the courage to be present and listen to those we lead, to seek to understand the challenges and to support them. And compassionate leadership is focused on delivering for the people that we provide care for across Northern Ireland. It's also focused on ensuring that we're providing staff with the support they need to deliver that care, especially given the hugely challenging circumstances they face and the very high levels of stress. So It's about having a laser-like focus on being effective and performance focused. I think it takes far more courage and authenticity than what can be the rather easy opt-out of command and control leadership, where I don't listen to people, I don't seek to understand their challenges or empathize with them. I just instruct them and tell them what to do. So it is, I think, quite the opposite of that soft cushion scented candles idea of leadership. It requires much more courage.
Jennifer, you're smiling at the soft cushion scented candles idea there. I mean, I suppose, at the moment, all of the various trusts are dealing with very challenging funding situations. As we've heard in many of these podcasts, no ministerial input. Civil servants still in charge, and to be fair to them, absolutely doing their best. But compassionate leadership, perhaps in those circumstances, does that make it more of a challenge?
I think it makes it more important than ever that that's exactly what we're doing. And I'll maybe kick off with a little quote from Eleanor Roosevelt, which I really love. And what she said was, "To handle yourself, use your head. To handle others, use your heart." And that, for me, is what compassionate leadership is about. It's the head and the heart. It's having skills and empathy. It's having competence and compassion. And I think we need all of those things. And I suppose when I reflect on it, I think what we now call compassionate leadership, I probably would have simply described as a facilitative style of leadership or a supportive style of leadership in days gone by. And I think we can probably all call to mind people that I would describe as very good managers in the traditional sense, but they also have a genuine interest and curiosity about people. And a real desire to listen, as Michael said, listen with fascination, listening to understand, and most importantly, to want to take action and do something about it. And I think in the situation in which we're working at the moment, as you say, with really challenging funding situation, and the fact that we don't have an executive and an assembly, it's also very difficult, of course, for our civil service colleagues as well. And I think there's something about understanding the very nature of the people who choose to work within health and social care. By and large, these are really committed, caring individuals. And they've chosen to be in health and social care. They've chosen a profession or a pathway. They want to be here and they want to do this job. So Michael's absolutely right. Command and control would be the wrong thing for those people. And it is very much about the fact that those will be the people who will know how to be creative and innovative in the place in which they work. Those will be the people with the really good ideas about how to be efficient and productive and to get the best performance as well. So for me, there's something for us as leaders in ensuring that we are creating and fostering the right culture to allow them to do the right thing, removing those barriers, creating that culture of the creativity and the innovation and the psychological safety and an open, just and learning culture as well.
That kind of compassionate leadership, Patricia, when you look at the workforce, in particular, perhaps the social care workforce right now, Jennifer and Michael talking about that business of listening to understand and doing something about it. I mean, you have a workforce that's currently finding new solutions, both to old problems and actually to new problems as well.
Yes, that's right. And I think, listening to Michael around the key parts of compassionate leadership and the listening and understanding is absolutely crucial. And particularly for a workforce like social care, we've got 37,000 social care workers out doing their best every day. And we really need to listen and understand to what they're experiencing and to help them then as we move forward to begin to deliver better social care services. And we've been doing quite a lot of work listening to our social care registrants. And what they tell us is that they're very proud of what they do. They're in social care, as Jennifer said, because they're caring individuals. They want the best for the people that they care for, and they're really hungry to learn and develop their knowledge and skills and deliver really good care. But they feel really undervalued within the system. They feel very undervalued in terms of what they do, not just in terms of their terms and conditions, but also how they're viewed within the overall health and social care system. So listening to our social care workers and also listening to the providers who provide social care services helps us to build an understanding and some intelligence around what the issues are and what we potentially can do to help. And you're right, it's listening and understanding, Jennifer, in order to take action. So we've been working very closely with the Department of Health to begin to say, how can we work compassionately? How can we develop compassionate leadership, collective leadership, to begin to tackle the issues that are facing social care? And we all know that there are some enormous issues facing social care today in today's context. So we've worked with the department to develop a social care collaborative forum, which will be positioned within the department's transformation programme at a very strategic level. And that's the first time that social care has risen to the top of the agenda and will be sitting alongside, the other really acute issues like hospitals, etc., etc. So we've managed with the department to position social care in that context, and working with providers right across all of the sectors, and including people representative of the sector, coming from the sector, social care managers, service users and the department, collectively to begin to think about how do we work together to tackle these issues, and how do we do that in a compassionate way that means we are listening and understanding to what the issues are and beginning to think about how we achieve the outcomes.
Very interesting. And Jonathan, as a board member, you're in a slightly different situation here, aren't you? And both as a board member of your trust, but also, if I could maybe for a moment look at NICON, which is the voice of organisations working across Northern Ireland's integrated health and social care system. And it very much supports leaders to develop. That must be crucial if all of the rest of this stuff is going to work.
You are right. As a board member, I am very different from both Jennifer and Patricia. They're embedded in day-to-day operations, and that's not what a chair or a board member should be. So it looks very different from the boardroom. It's still the same theme. It's still the same processes. It's still that same compassion, but it's demonstrated in different ways. And once we get into NICON, that collection of leaders right across the whole HSC family, where we bring all of those, what the department refers to as arm's length bodies, into the room, to try and have that joined up conversation and mirror those behaviours and cultures and habits across the piece, as opposed to in a silo type environment where we're only dealing with our own organisations. It's about sharing, and it's about putting out to the system and putting out to all arts and parts those positive behaviours and that support and that nurture for people who find themselves in very, very difficult places. And leaders right across the system have found themselves for the last couple of years under the cosh right across, no matter what their piece has been doing. There's a large expectation from the public. They are dealing with an exhausted and a depleted workforce, but yet they need to deliver the same high calibre results day after day.
And that kind of high quality leadership must be even more important in those circumstances. I mean, we all know people in the health and social care system who, as you say, are exhausted after the last few years, and you often hear them complaining that nobody ever listens to them. Well, apparently that isn't the case anymore, and so you're setting a strategy and you're trying to get the compassionate leadership to work on what I suppose are big ticket system things, really major, sizable operations.
If we can get it right, and this cannot be a top-down type raining down from on high. This has to be embedded and grown at all levels, at all ranks, at all statuses right through the system. We need to move away from that whole hierarchy that the boss is in charge and the boss does it. There are incredibly creative people right through our systems, right through the family of HSC organisations. And we need to tap into that. We need to tap into their resources, into their mindset, into the things that they see on their day-to-day travels and work, and then start to, at pace and scale, push that out right across to other organisations and infiltrate ourselves with positive, good ideas and that empathy that Michael talked about at the very beginning. You have to be in there alongside people. There's no point in being an armchair general and expecting troops to go over the top. You've got to be in there with them, sleeves rolled up, and saying that I understand the difficulty it is. I understand what it is. So I'm going to walk with you. And I think that's important to get those skills to those that have leadership roles, that they can then permeate that out and down and through their organisations.
Michael, the whole compassionate leadership approach, at least a large part of it must be to help to support the health and the well-being of staff, and to, as you said at the very start, to help them to the very best of their abilities to work with and help the clients and patients that they're working with. So that all sounds fine, but I imagine that there must be aspects of that are a real challenge to roll out properly.
Well, the situation that we face in health and social care at the moment, I think, represents the biggest crisis that we've ever had in the history of our health and social care systems. And part of being an effective leader, I think, is acknowledging where we are now in an honest and open way. As we've said, these behaviours are not new. It's not some new model of leadership. We've known for 60 or 70 years that these 4 behaviours are critical to effective leadership, and that the most important skill of a leader is listening to those that we lead. And the most important task we have is to help those we lead to do their jobs more effectively. And part of that is about supporting their well-being. And, we have in the English system, in the NHS, we have 20 years worth of data from a national staff survey, which over 160,000 people complete every year. And what that shows us is the more leaders who, in a trust, who are rated by their staff as listening, understanding, empathizing, and helping, subsequently what we see in those organizations is significantly higher levels of staff engagement, better staff well-being, better care quality, better financial performance, higher levels of patient satisfaction, and in the acute sector, significantly lower levels of avoidable patient mortality. So, this is a means to achieve what we want to achieve, delivering high quality, continually improving and compassionate care for the people we serve. And in order to do that, we have to ensure high quality, continually improving and compassionate support for the staff who deliver that care. Those two things fundamentally and intrinsically are intertwined. So, when we look at all of the data we have about the performance of health and social care organizations, it tells us the most important factors are staff engagement, leadership, those behaviors, including people, good team working and inter-team working, not having chronic excessive workloads, and the opposite of well-being, burnout and also, of course, good morale. So we know what delivers the outcomes we seek, and compassionate leadership is absolutely core to that.
Patricia, the social care workforce have now a clear voice, as you said, at a strategic level. So are you seeing examples of collaborative leadership coming through? I mean, Michael was talking about having the data there. Are you starting to see that coming through?
Well, we've been working with our Leaders in Social Care Partnership, which is a partnership of providers of social care for a number of years. And the outcome that we have now in terms of the Social Care Collaborative Forum is as a consequence of the work that partnership has been doing. So, and that's leaders across a variety of sectors, statutory, private and voluntary sector, who worked together to develop a compact, if you like, an agreement around how could we begin to work together to to try to sort the issues and find the solutions. So yes, we are beginning to see that happening. There's a long way to go. There will be lots of difficult conversations to be had as we go into a collaborative forum in terms of how we arrive at solutions. But absolutely everybody is pointed in the same direction. We all want the best care for the people who, whether it's social care or healthcare, we want the best care for those who need it. So yes, I am starting to see that, where you can set aside your own particular issues to look at the collective good. So I'm very optimistic about the collaborative forum, and I've seen that grow through our Leaders in Social Care partnership.
And the same behaviours apply in how we relate to each other across boundaries, working with different teams, different departments, different organisations. Leadership is about attending to them, listening to them with fascination, seeking to understand their challenges, empathising with them, and always asking the question, how can we help you, so that collectively we deliver more effectively for the people of Northern Ireland?
You're nodding furiously, Jennifer.
I am indeed. I'm sorry to mention the pandemic, but I actually think it did teach us an awful lot, and I think it is worth mentioning. It tapped really into the heart of what we tried to do to look after our staff around their own health and well-being, recognising that often they were being redeployed into different teams. They were working across different teams, new teams being formed and coming together. So I do think that bit is absolutely crucial about getting that teamwork right and wrapping the health and well-being around it. So we knew, across all organisations during the pandemic, significant staff supports put in around their health and well-being, psychological support, drop-in clinics, helplines, umpteen things. And actually we realised what it was able to do in relation to giving people that sense of autonomy and belonging and control. And there was lots that I know different organisations have taken from that as we worked our way out of the pandemic, and as we move forward now in a new challenging situation, how we continue to look after our staff as well.
And it's interesting because talking of the pandemic, I might as well get it out of the way to a degree. But I've spoken to many people who said it's the first time that they had ever been in a situation where their boss, like their big boss, was speaking to them when they were sitting on the landing or wherever at home. And the first thing that the boss asked them was, how were they? Are you okay? Are you managing? And they said, well, many of them had never had a conversation with the boss before, and it certainly hadn't started with, how are you? And we were all nodding at this point, but that was a big change, Jonathan, wasn't it? And I mean, that's one of the changes that we really need to hang on to.
Very much so. And from my own personal experience, at the height of it, I answered my phone late one evening, and it was the health minister ringing me at home to say, how are you? What's happening? Are you okay? What about your team? So I think it was demonstrated right at all levels, that empathy and that care for others, as to we're all in this together. So we actually need to look after and we need to care for each other. So I had personal experience of that, and I tried to demonstrate that with my chief executive and with others in the senior management team at the same time, and relay those same behaviours that would then encourage them to cascade that down. Not that they need encouragement, but it begins with all of us, and it permeates out. And going back to a little piece from earlier to link with that, we have such large organisations, and there is the temptation, has been the temptation always, to use a command and control for the sheer size of it. So we have directors, we have assistant directors, we have leads, we have seniors. All of those titles looking like a hierarchy, and that you can't do anything without the one above of having approval or giving you consent. So we have a little bit of work to do in this, and the pandemic, the P word again, removed some of those barriers for us and allowed us to get past some of it, because, as Jennifer talked about, we were all disrupted out of our normal hierarchical programs, and we joined different teams and came under different responsibilities. So that allowed different conversation from what we had before, and I think the sheer pressure of what we were experiencing allowed us to be able to drop our guard and become human. And that interaction, I think, has paid dividends. We've seen that. But it's now making sure we hold on to that, and that through these large organisations, we just don't think it is senior people that are looking for it, that can demonstrate it, it comes through all ranks.
That is an interesting one, isn't it, Jennifer? Because if you have an organisation like yours where you have, as Jonathan says, on paper it is the hierarchical, there are all kinds of levels and so on. You have leadership at lots of different levels, and some of those people who are in a leadership role are among the most stressed, the ones who are both leaders but also at the coal face, if I could put it like that. So how do you get that compassionate leadership and the collective and collaborative elements to work at a level where people are just stressed to the nth, basically, and that's not at the top of their list. I'll bring Michael in a second, but Jennifer, just
yeah. So I think there's a huge part of compassionate leadership. Also has to be about self-compassion, and that's something that we try and help our leaders at all levels in the organisation. So that they're only going to be able to be compassionate to their own teams if they have that element of self-compassion as well. And it is very challenging whenever we know that people are incredibly busy. The workload is too great in many places, but it is trying to tackle that the challenge that they have, the scale of the work, and still encouraging them to take time out to look after themselves, because only then will they be able to look after their team. Jonathan mentioned mindset earlier on. I do think that's a big component of how we go in and do our jobs every day. We're only going to be able to be in the right mindset if we've had that self-compassion and looked after ourselves. It's the simple things, it is about getting enough sleep, it is about eating well. All those things actually do make a huge difference to how we individually feel on a day-to-day basis. And that, along with the skills of a good manager and listening, then I think puts those people in the right place to be able to lead their teams well.
Michael.
Yes, so I absolutely endorse the fundamental importance of leadership, self-compassion, to be as underpinning our ability to be compassionate towards others. But I wanted to weave a couple of points together. We talk about the extended hierarchies in the health and social care system, and it is absurd. We have the largest, most skilled and most motivated workforce in the whole of industry, yet we still have these hierarchical organisations. And yet we also want to work across boundaries between health and social care, with local authorities, councils, with employment, with housing, with voluntary sector, with communities, with families. And, we're only going to be able to do that if we begin to change these hierarchical systems. How do we do that? Well, I think we have to have the courage to reduce the number of levels, but also I think the solution is developing more effective team-based working. We know that only about 40% of staff in healthcare organisations work in teams that have clear goals and meet regularly. And yet we know the more people who work in such teams, the better is the quality of care provided, much lower levels of staff stress, and much higher levels of innovation. So team working is about trusting people at local level to make decisions. Look, the military now uses mission command. The strategic decisions are made by senior leaders, but people at local level are completely trusted to make their decisions about what's intelligent and appropriate for their local circumstances and the changing circumstances. I think we've got a lot of work to do to build team working as the way to reduce hierarchy and into team working. And that's about ensuring that we start to think about doing team appraisals rather than always focusing on individual appraisals. Let the team members do the individual appraisals. Why don't we provide team coaching? Let's train leaders to lead teams compassionately so that we're truly managing teams and into team working rather than creating these hierarchies of managing individuals. And we know, as I say, that releases innovation. Teams are if you like, the engines of innovation. It ensures good team working, we know, ensures better team member well-being, and we know it's associated with higher levels of productivity and lower workload for staff as well. So there is a solution, there is a route to all of this.
That is very vital, but I think there's part of our world as well with the complexity, Michael, and Patricia will be acutely aware of that. Many of our community staff and people work on their own. They get up in the morning, they jump into their own car, they drive halfway around the country, they call into houses, they come back out. So we have something to do there as well in that, and somehow combining them. And I am not the operational person to make those kind of judgment calls, but I'd be interested to hear.
If I could just jump in, the example we have is the Buurtzorg system in the Netherlands.
I was just going to say that, Michael, and part of the work that we want to do in relation to, as part of the Social Care Collaborative Forum, is begin to look at new models of home care, and that would be one of the models that we would be exploring. So I think you're right in terms of how do you build that team-based, locality-based approach to the delivery of home care.
Tell us a bit more about that, will you? Just a little, if you could, about what are they doing differently in the Netherlands?
Well, I don't know. I don't know the detail of what they're doing in the Netherlands, and Michael might know that better than I. But it's more about a team coming together and being much more self-sufficient. So the team itself can make decisions about how they manage their calls, how they deliver the care across their locality, rather than, as we have now, someone is just given 15-minute calls to do, and that's their run and they do it. So this is more about giving the team, as Michael talks about, the ownership and the responsibility for being able to manage the delivery of that care within the area that they're responsible for. And my understanding about that, Wendy, without knowing the detail of that particular work in the Netherlands, is that does give better outcomes, both for the individuals who are receiving the care, but equally for the team who are providing it. They get much more job satisfaction.
That's absolutely right. I mean, they have 10,000 staff now in Buurtzorg. They have 2 levels. They have a central team, and then they have teams, local teams all across the country, who work in collaboration with patients, with carers, with the community, as real teams to deliver care locally and intelligently in their own way. And they're rated outstanding in terms of the care they provide, and the well-being of team members is really high. Just 2 levels in the entire system. And it's a model for many of us, I think.
I suppose, Wendy, I was just going to come back in on the issue of trust, which I think is really crucial, and what Jonathan was saying about, our frontline staff who are doing the job every day, and their managers as well. People who are doing the job know what will help to make it better.
Absolutely.
And we as leaders, that's what we really need to be listening to, and then working with that. So it's that bit about, Michael's bit about listening and attending, but also really and trusting the fact that the people who are delivering the care know exactly what they're doing, and therefore they can tell us what would be better. And I was talking to a group of leaders the other day, and one of the things I said was, we really as leaders should say yes long before we ever say no. And in our system, quite often what you hear is, well, no, we couldn't possibly do that. Or, there's always the resistance. There's a bit of that resistance to change. But in terms of innovation, and Michael talks about innovation, I think it's really important to say, okay, yes, let's explore that. Let's see where we can go with it. And if it's not going to work, then obviously you're saying no, if it's too expensive, whatever. But there's a tendency in our system to resist that. And that's a bit about trust, because then you're saying to your team, yes, go and explore it. I trust you to go and explore it and see where you get to.
Jennifer?
I think the trust is vital, and the trust is both ways, us trusting our staff and our staff trusting us. And that, for me, is about values and behaviour. And I think it's worth reflecting on the shared values that we have within our health and social care sector. So this arose out of some great work done a few years ago across quite a number of our organisations. And we have 4 shared values, and they are working together, excellence, openness and honesty, and compassion. And of course, for me, those values have to be underpinned by the right behaviours, and our staff have to see that everyone throughout the organisation is living by those values, and that's the bit that gives you trust. And then the opportunity to release people, to let them do what they know is the right thing to do.
Is it more difficult or less difficult, I wonder, Jonathan, when times are as tough as they are at the moment, to to go down a different route. You know, I can't remember who it was that said if you keep on doing the same thing, you know, you're not going to get a different result. So Patricia saying yes from time to time at least isn't the worst plan. So in a way, does that open a door for going down a different route and for getting that compassionate leadership to work throughout an organisation?
It's like the old sort of Irish statement that if I was going on a journey, I wouldn't start from here. And I mean, Michael will know this more than most of us. There's significant barriers to this kind of work. Things like conflict, poor work conditions, poor leadership, excessive workload, excessive data, excessive reporting, bureaucracy, undervalued personnel. So we have the perfect storm right now, I think, in our workforce and in our environment, where actually we have barriers in every direction we try to turn to try and do this. And yet this is the only route out for me. We cannot stay with the old command control type structure and the hierarchy that Michael was talking about. We cannot stay with outdated models that we have used in the past. This has to be the most creative directive that we can use to put value back into our workforce. And with that value, start that conversation. And how do we remove the excessive reporting? How do we remove the bureaucracy? How do we make life easier for you? Somebody talked earlier about removing the barriers and the roadblocks that will help people on their way. And I think a lot of that both the pandemic and the sheer pressures of life and cost of living and everything that's around us have pressured us into. This, for me, is the direction we've still got to travel. And we've got to find ways to overcome some of these difficulties. But I think that's where, again, collective leadership comes into it. The chief executive or the chair will not have all the answers. But you can be pretty sure through across 11,000 people in one of our trusts, there will be people in there with answers and ideas and concepts and new motivations and new ways of working. And it's about us tapping into that, finding those people and raising their profile, raising their platform and allowing us to learn from them. And Jennifer talked about the two-way thing for trust. I think it has to be two ways as well. We do not have all the answers, but there are people, and again, as Patricia was talking about, who do the job day to day. They could see an easier way. They can see how to remove some of those barriers, or what was removed would make it twice as easy. And those are the people we need to get to release the roadblocks and make it much easier.
Michael, one of the people I was speaking to the other day was talking about the war for talent. And here in Northern Ireland, we've gone from a situation where I think most of us sitting around this table can remember when the nightly news once a month reported that Strabane, it was usually Strabane, had the highest unemployment rates in the UK. We now have virtually full employment of people who wish to work, and all of the employers that you speak to are having enormous difficulties in getting staff. And this guy was saying to me that the war for talent is over because actually the talent has won. And in a health and social care context, that has to be taken into account as well. It's not just the tech industries. It's not just all of those new jobs that have come up. We're all living in the same world at the moment, aren't we? So I wonder to what extent that puts perhaps a very slightly new focus on things too, and makes what you're talking about all the more important.
Yeah, well, I think as everybody has said, and Jonathan just pointed out, the situation that we currently face is not amenable to continuing to do what we've always done. We are facing global competition for staff. You know, the shortage of nurses, for example, is global. It's not just a UK problem. And we have something like 140, 150,000 vacancies across healthcare in the UK, and something in the region of 170, 180,000 vacancies in social care. And those staff who are motivated to provide care are being sought in many countries. I talked to colleagues in Ireland, the Republic, in Denmark, in Canada, in the United States, and across the world, and there are huge shortages. So we talk a lot about attracting and recruiting staff, but if the bucket has got a hole in the bottom, you can pour as much water in it as you like. Currently 1 in 4 nurses leave the NHS within 3 years of joining. Well, it's not sustainable. So there's a burning bridge that tells us we have to do things very differently. And I think that all of the evidence we have about what predicts the performance of organizations tells us that compassionate leadership and supporting staff and enabling them and giving them the autonomy and control and a sense of belonging and an ability to do jobs to the quality that they want to do them, that's consistent with their values, is the only way forward. As we've all been saying, this is not an option. This is not a choice. It's the imperative for the future.
And Jennifer, you need to embed this and bring the public along with you.
Yes, we absolutely do. And I think that's going to be very challenging, particularly at a time whenever I think the public has lost a lot of confidence in our health and social care services. They only have to turn on the television or social media. The challenges at our emergency departments, the challenges that we have in our elective waiting lists, the challenges that we have getting domiciliary care packages. So huge issues for us. And I think there has to be that open and honest conversation with the public as well about just how stretched and how difficult things are, and therefore some of the brave decisions that we might have to take, how we need to go about doing that, and having the same kind of compassionate conversations with the public as we need to have with staff right across the organisation. And I think where we do have change, making sure it's those staff who are from the service themselves, who are talking about the challenges that they face, why they might need to make a particular change, and why they are the right people to talk about this and to engage with the public. So I think that time for that societal debate is probably long overdue, but the compassionate conversations need to be with them as much as they need to be within our organisations as well.
And Wendy, what I was going to say was when it goes right, it goes well, because last week we had an email that popped into our inbox and I thought it might be useful just to read it, because it sort of reminds us why we're doing what we're doing. And the email was from a 92-year-old lady. And she said, "I'm now 92 years of age. I am housebound, living in a rural area. I am fortunate to have had a package of care for the last 5 years. These care workers are very faithful and have become my friends. Without their help and support, it would be difficult for me to continue to live in my own home. I would like them to be acknowledged. On behalf of all those who are housebound, I feel it is very important that we remember our faithful carers. They come daily and cheerfully encourage us with positive thoughts." So that's what good care looks like.
Well, that's good to hear, isn't it? And those are the kind of stories, Jonathan, and those are the kind of messages, I suppose, that we need to be getting out there, as well as the honest conversation, the other honest conversation about the challenges and so on.
I wouldn't want a media bash, but one of the difficulties...
go ahead.
Good news stories don't travel well across media. It's sensationalism and it's the bad stories that carry well and get the airtime. Every day across our system, tens of thousands of individuals have incredible interactions with healthcare professionals, and in their own home, in hospital wards, in clinics, in settings for counselling and all sorts of environments. And it's the right person at the right time, and there's a holistic approach where the person begins to recover, get well, get treatment, and those things just go unmissed. But the thousands of our workforce that turn up every day and do that faithfully, as this lady has talked about, are immense, but they go unnoticed. That's just our normal bread and butter. And we've got so used to that, and it just becomes so blasé that we just don't pay attention to it any longer. And I think that's where we have missed a trick in all of this, and this is where this empathetic piece comes back in, and it's where listening with intent to our people and understand what they are doing and hear from the public. We actually get twice as many compliments as we get complaints in cards and letters and thank yous, but they actually never make the light of day most time, or it's a small part of a report at the end of the year. And I too will receive conversations, and people who, when I socialise, who know what I do, will often come up and say, "I was in your hospital. I was in ward such and such. Incredible treatment. The girls and the fellas in there going above and beyond what they do. And we will all have stories of that, because 99.9% of the time, that's what happens in health and social care. Folks are met at their point of need with the most incredibly passionate and empathetic professionals and clinicians and assistants and helpers. So those are the things that we never must miss, and we must build on that and capitalise it. And we haven't to date. It goes by, just as I say, as our bread and butter, and we move on and we firefight and other things. But there are massively positive things in there that we need to celebrate and recognise.
Michael, just a sort of final point. I mean, there's a great tendency nowadays for blame. You know, who's to blame for this? Who do you blame? I blame so-and-so. Are you going to apologise? Etc. And it's all a matter of pitting people or services against one another and sort of othering them, if that's the right way to put it. The kind of compassionate leadership that you're talking about, I'm guessing, means that organisations and parts of those organisations are going to be able to work more together and form kind of coalitions of the willing, if I could put it like that.
I think the biggest challenge we face as humanity is caring connection with each other. The challenges we now face across the world require us to work together. You know, climate change, for example, health inequalities, poverty across the globe. And within our health and social care system, the only way we're going to be able to respond to the challenges is to work together and to see ourselves as united in that endeavour. And we know that what builds trust across boundaries is just having contact continually, taking the time to be with each other, to listen, to understand, to empathise, to help, and to have a shared vision that, what we're here for is to create the conditions across Northern Ireland where people can live happy lives, where they feel fulfilled, where they feel safe, where they feel loved, whatever age they are, whether it's young children, adults, or people at the end of their lives. And that's our shared purpose. And the only way we're going to fulfill that vision or achieve that vision is by working across boundaries, as you say, not to other people. And it is, it's not easy. It's a big challenge because we do tend to form tribes, but our way forward has to be to have the courage and the persistence to build relationships and trust across health and social care, primary and secondary care, with local authorities, with, as I was saying, the voluntary agencies, and for communities themselves to co-own and co-design services with us so that they are compassionately, effectively, and powerfully involved in what we're seeking to achieve.
Michael, thank you very much indeed. And thanks to all of you for joining me for this Care to Chat podcast. My thanks to Michael West, who we've just been hearing from, to Patricia Higgins, Jennifer Welsh and Jonathan Patton. This has been Care to Chat, a podcast from the Northern Ireland Social Care Council. Thank you so much for listening. And if you'd like to learn more about careers in social care and social work, visit niscc.info, where you can find inspirational stories, great learning resources, podcasts, and much more.